Good morning, student. Today we are going to start with a new chapter, that is chapter number 4, psychological disorders. So in this chapter we are going to discuss about different types of abnormalities, and we will know about different types of models that are developed in order to know the cause of abnormalities. And secondly, we are going to discuss about different types of disorders that people tend to suffer. And in this chapter, we are going to discuss about what all changes take place in an individual when one suffers from psychological disorder, changes in their behavior and changes in their social activities. So children, it is often believed that mental disorders are disturbances of an individual's behavior or psychological functioning that are not culturally expected and that leads to psychological distress, behavior disability or impaired overall functioning. And secondly, in this chapter, we are going to discuss about the modern psychological view. It often suggests that mental disorder involve biological, psychological, and socio-cultural factors as well as the joint effect of individual vulnerability. Many psychologists have developed DSM-4. It means Diagnostic and Statistical Manual of Mental Disorder is a widely used to guide mental disorders. So the people who tend to suffer from behavior problem or unable to keep their thought process, so those people are diagnosed by using DSM. It provides a description of these disorders and information about biological factors associated with them. It means DSM-4 is used in order to know whether the particular disorder has occurred due to the biological factor or by some other factor. Now, treatment is done by using different types of methods such as life record, assessment interview, psychological test, observation behavior, and biological measures. Now, children, in this chapter, we are going to discuss about ADHD. Now, ADHD is a disorder. The full form of ADHD is Attention Deficit Hyperactive Disorder. Is a disorder, childhood disorder in which children show inattention, hyperactivity and impulsivity. As you must have seen around in your class that there are some children, those who are very impulsive in nature, they keep on moving here and there. They cannot resist to sit in a particular place for a longer period of time. So those people tend to suffer from ADHD. Now talking about the another type of disorder, that is anorexia and bulimia. These are the two types of eating disorder that we are going to discuss in this chapter. It involves, now talking about anorexia nervosa, it involves excessive fear of becoming fat. So people tend to consume less food and often believe that they are getting fat. They often believe in doing dieting. On the other hand, talking about bulimia nervosa, it involves repeated cycles of binging and purging. It means after eating food, they often purge at a regular interval of time. Now children, talking about the another type of disorder that we are going to discuss in this chapter is autism disorder. Now this disorder is a disorder in which children show marked impairment in establishing social interaction with others, have poor language skills and show stereotyped repeated pattern of behavior. The people who tend to suffer from this disorder, they tend to show lack in their confidence level, as they are unable to mix with other people in the society, or they are unable to form their opinion in front of other people. So these people tend to show poor language skills. Now talking about the another type of disorder, that is depression. It includes a negative mood, difficulty in sleeping and significant changes in weight. So in this chapter we are going to discuss about depression, what is depression and what are the symptoms of depression. Now children, talking about the another type of disorder, that is bipolar disorder. In this disorder, a particular individual tend to show wide swings in mood between deep depression and mania. So children, bipolar disorder is a disorder in which symptoms of depression and mania can be seen. Now after this we are going to discuss about the phobias. Now there are different types of phobias. Some people tend to suffer from agoraphobia. Now phobias are the irrational fear related to a particular object, or we can say that phobias are excessive and unrealistic fear focused on specific object or situations. Now talking about the another type of disorder, that is obsessive compulsive disorder. In this type of disorder, individuals have uncontrollable and unwanted disturbing thoughts or mental images. Now in this chapter we are going to discuss about PTSD. Now full form of PTSD is post traumatic stress disorder. Is a disorder in which people re-experience a traumatic event in their thoughts or dream. As we know that the traumatic events are those events which are not under the control of an individual, and when they occur it tend to have an harmful effect on an individual's overall functioning. So children, as I have discussed about different types of disorders, we are going to discuss in this chapter what are those disorders and what are the causes of those disorders along with the symptoms of a particular disorder.